On to the next subject, which is diverticular diseases. Now, before when we did non-ulcer dyspepsia, we said pain up here, but what about pain down here? Well, we know if pain down here is in the right lower quadrant, that's appendicitis. And we know if the pain is down here, why that is diverticule. Down here, left lower quadrant, diverticulosis or diverticulitis. Diverticulosis or diverticulitis. Diverticulosis or diverticulitis. And the answer is that what we have to do here is that we have to get the knowledge of whether or not there's fever or an elevated white cell count. Fever or an elevated white cell count. If we see fever and an elevated white cell count, those diverticuli are infected and inflamed. Now, diverticulosis can cause pain here. Diverticulosis could even be tender. But diverticulitis is always going to be tender, always going to have fever and a white count because it's infected. Now, they're both caused by low fiber, high fat, high red meat, low brown rice, disgusting bacon cheeseburger, Western American, disgusting bad Hindu diet, and your colon starts to pop out with diverticuli. It's so common as to almost be considered normal as a part of our society. Now, the difference diagnostically is diverticulosis is best diagnosed with endoscopy. But diverticulitis is best diagnosed with abdominal CT scan. And the reason is that we don't want to have the small risk of perforation that you might get with someone who has diverticulitis is having a slightly increased risk of perforation with the endoscopy. Whereas CT scan never perforated anybody. Endoscopy is always the best for diverticulosis. Barium is okay. But in diverticulitis, no scopes, no barium. Why? Because we don't even want a slight or even a little, not the slightest chance of perforation do we want in case you have diverticulitis. We don't want that because although it may be only small, we want a test that has zero risk of perforation. Both of them get treated with fiber. Now, you may be an all-natural person and your fiber you may want with something like psyllium husks. You may be more of a medical person and you want a little Metamucil. You may be an over-the-counter, all-natural, don't shave my armpits kind of person. And you may be somebody who wants to have just bran muffins. And you know what? Whatever way you get bulk in your butt is good for you. Whether it's bran, Kellogg's all-bran fiber, bran muffins, psyllium husks, Metamucil, towels, as long as you can bulk up your bowels, you'll be fine. It decreases the pressure in there. Now, diverticulitis you treat with predominantly ciprofloxacin. Ciprofloxacin is for gram-negative rods predominantly. And metronidazole is an anaerobic drug. This looks a lot like the treatment for the perirectal Crohn's disease because it is like the treatment for the perirectal Crohn's disease. So ciprofloxacin and metronidazole for the perirectal Crohn's disease. That's what the treatment for these are. So fever, white count, tenderness, ciprofloxacin, and metronidazole spank you very much. And that's the only answer for diverticulosis, diverticulitis. Left lower quadrant pain, and it's almost always going to be people above the age of 60. Left lower quadrant abdominal pain, left lower quadrant abdominal tenderness in people above the age of 60 on a big, fat-filled disgusting Western diets are going to develop pain. If there's fever and a white count, it's infection. You get an abdominal CT and give antibiotics. The other alternatives to cyprometronidazole is second-generation cephalosporins, which is cefoxitin or cefotitan, which are the other anaerobic second-generation cephalosporins, or the combined beta-lactamase inhibitors, amoxicillin, clavulanic acid. That's one drug. Amoxicillin, clavulanate as one drug, and all of these are okay. It's just that Cipro combined with metronidazole is the drug of choice and is the #1 recommendation.